Welcome to another edition of the Health Insurance Store Webcast. I am your host, Aaron Zolbrod. I am also the president and founder of the Health Insurance Store, opened April 1st, 2008. I can't believe how long it's been. For those of you who haven't listened before or tuned in to a webcast, again, they're new, or webcasts are new, and again, I apologize that I have a face for radio. You can always just listen on the podcast side if you'd like. Again, I'm Aaron Zolbrod, president and founder of the Health Insurance Store. We like to join you weekly and discuss in detail the recent question that we get on my columns that I run in both the Post-Gazette and the Trib. The Post-Gazette is every Friday, page A2, and the Tribune Review is page A7. You can also catch those on their digital edition if you don't get the paper, the actual old school newspaper. I don't even know what you'd call that anymore. I still like to flip pages of a paper once in a while myself, but I know I'm trying to move into the 21st century, folks. So bear with me if I scuttle around a little bit when we're doing these webcasts and podcasts. This is all new to me. I'm still kind of an old school guy. I was that guy. I went to college when you had to borrow the guy's typewriter. If somebody had an electric typewriter in your hallway, you borrowed it to turn in your papers. And I remember, I think my sophomore year in college, if you were really, really lucky, you knew somebody with one of those word processors where the screen flipped up. It wasn't until my senior year in college where we actually could go to a lab where it had a word processing lab where we'd all share one printer, and you'd hit print and you'd go up there and fight with 26 people to say, no, that's my paper. That's not yours. That's mine. Wait, I'm missing page 12. So listen, guys, I'm almost 50 years old. Bear with me when I work through these technical stuff. So as you know, if you've watched before, we like to get in depth with the question that we've received in the column called, again, Ask the Medicare Specialist. We also do, at the Health Insurance Store, we also do group plans. If you own a business and you want to provide your employees with plans, if you're a small business owner, like a one-man plumbing operation, or you work at a job where you don't get insurance, we'll help you find individual healthcare insurance. But we really focus a lot on Medicare, and that's what we're going to focus on today. And I want to go over the question in just a moment. Let me give out the contact information. If you want to call us via phone, it's 724-603-3403. That's 724-603-3403. The website is getyourbestplan.com. That's GETYOURBESTPLAN. You can catch us on Facebook, the Health Insurance Store. Didn't mention this in my last podcast, but we do have two offices, one in Connellsville, actually three offices, one in Connellsville, one in Forest Hills, which is our Pittsburgh, Allegheny County location. We have one in Erie, in case anybody is joining us from that area. So let's get into the question. It's from Patty. And it says, in a very recent column, you discussed a patient assistance program that will provide many expensive diabetic medications for free. You also said you could supply the application and assist in its completion. Do I have to buy your Medicare insurance in order to get that help? And the quick answer is absolutely not. First, I want to make sure that you understand this. When it comes to the Health Insurance Store, there's no such thing as our insurance. So the Health Insurance Store is not an insurance company. We're not limited to selling just one brand of products, nor are we beholden to any company. Myself and the other licensed at the Health Insurance Store, we're brokers. So we're appointed to sell products and provide products from virtually every company on the market. We're not just, we're not just like a State Farm agent or a, farmer's agents where you've seen those commercials on TV. We can supply you with policies from virtually every company provider on the market. What that does ensures unbiased advice and the best value for you. So we get paid the same whether you buy it from company X, company Y, company Z. It's all pretty similar. So our only goal is to make sure that we're getting you the best possible value in insurance. And a lot of times, believe it or not, I'd say 25% of the time, we're going to tell people, hey, you don't need us. You've got this insurance that you can get through a company you retired from. Like if you're a retired teacher, retired school worker, you've got the opportunity to you've got VA. That's going to make a difference in what we tell you to do. So a lot of times we'll say, listen, you don't need us, and make sure you never let a guy like me into your home to talk you out of that plan, which, trust me, when this business that we do is getting very competitive. And for especially people just starting in, to try to scratch out a living is not easy when you just started doing this. And unfortunately, when it comes to money, it may cause people to give some advice they normally wouldn't if they were more financially stable. And we've been in this business, like I said, since 2008. We have over 10,000 clients. We've been blessed that it's been very good to us. So our number one goal, and has been from the beginning, is we're going to give you advice based on what's best for you. Has nothing to do what's best for our paycheck, okay? So again, when I got this question, again, the question is, this patient assistance program, so I'm going to get into that briefly, is there's these patient assistance programs that are supplied by drug manufacturers, and they're providing medications for free in a lot of cases. So I already done a column about this, and this was a follow-up question, and she was thinking I wouldn't give that application or help anybody get these medications for free if they weren't a client of ours, or they had to buy insurance from me in order to do that. And I kind of chuckled when I got this question, because we always provide advice and consultations at no cost. We've been doing that since the day we started, and we'll provide anyone an application for one of these programs who makes a request and guide them through the process. It's not necessary to be a current client or change plans to do that. In fact, after I get done doing my webcast today, I have an appointment at a little later to help a lady who was denied. Her application for one of these programs was denied, and we think it was in error, and she's not a client of mine. And I'm going to get on the phone with her and find out why. I've been in the health and Medicare insurance, again, going on 13 years now, and from day one, I've seen what a struggle is for many seniors to afford their life-sustaining medications. I've watched brand name drug prices, specifically insulin, increase 400 to 500% in less than 10 years. That's crazy, because in 10 years, inflation for regular goods and services gone up just a fraction, if at all. But for some reason, medications, we're talking 400 to 500% for for medications. We're talking about insulin that used to be $125, $150, is now $450, $700, $1,000 for diabetic medications, and that's per month. I'm not talking about per year, okay? $1,000 a month for almost $1,000 a month for one of these new fancy non-insulin injectable drugs that are on the market now. And, I'm appalled. I am appalled by the exorbitant costs, especially what they cost compared to other countries. So that drug that's, almost $1,000 for a 30-day supply in the United States can be purchased for $350 in Canada. Same exact medication, made in the same exact factories. This is something that, again, that I want to help pull the curtain at. Why is this? We're gonna talk about that as time goes on. So stay tuned. I'm trying to get a pharmacist in here to tell us what's going on with this. Basically, if you want to Google this and research this, there's something called pharmacy benefit managers in the United States that they don't have in other countries. It's basically the middleman. So between the manufacturer and the actual pharmacy, there's a middleman who marks it up. That's what he gets paid for, or she, or whomever it is. They get paid to mark this thing up, $400, $500, $600, and then it goes to the pharmacy. It's not the pharmacies that are making a ton of money. It's the pharmacy benefit manager and the drug manufacturers that are making all that money. So again, I've been extremely focused on finding ways for seniors to save money since I first discovered, 12 years ago, what a widespread issue it was, these exorbitant amount of medications when people get into what's called their donut hole, which we have discussed on. And trust me, those of you who've been in it know what it is, and it doesn't take long. But so I've always been focused on this. I mean, I've always said, hey, you can get drugs at some pharmacies for less not using insurance. You can do that through the website now, GoodRx, PACE and PaceNet, and other programs. But so we recently discovered a program through one of these patient assistance programs that changed policies to help some of those on the most common expensive diabetic drugs save thousands of dollars a year. And it's one of the biggest developments since Pennsylvania raised the PaceNet income limit. It may be even bigger development since even PaceNet was around, and here's why. The patient assistance programs are open to tens of thousands of more seniors than PaceNet because the income limits are as much as $30,000 higher than it is for PaceNet. So tens of thousands of people in Pennsylvania are going to qualify for these patient assistance programs that don't qualify for PaceNet. We're talking about people that have are spending $3,000, $4,000 a year on their medications. And so there's even more good news. Since the last column I did on this topic, we found 2 other programs that are also offering diabetic medications at no cost. And so in case you didn't read that column, or in case you didn't tune in to that podcast or webcast, or need a refresher, so these patient assistance programs have been around for a while. At first, they wouldn't cover people who had Medicare. And then they started to cover people that had Medicare when they hit the donut hole. But there was some couple loopholes. First, again, you had to hit the donut hole. Secondly, you had to spend as much as between $900 and $2,400 out of your own pocket before they would give you those medications for free. Well, we've discovered 3 programs that will offer you those medications for free immediately as long as you meet the income requirements. So again, they removed these 2 obstacles, A, hitting your donut hole, and B, spending between $900 and $2,500 out of pocket before you could get that medication. So all you have to do is meet the income requirements, and I have them right here. These are the income limits for those of you who qualify, and it's very, very simple. If you're a single person and you make $51,040 or less, or you're a married couple, and again, take a look at the screen here, $51,040 as a single person family, or if you're a married couple and it's $68,960, you qualify for this program. I'm going to leave this up there for a second. You qualify for this program, okay? And it's beautiful. All you have to do is apply. You have to give them your income limit, and then you have to send that application in. Now, one application, you have to get it filled out by your doctor, and that could be the biggest problem that you have with that. But, I mean, this is a big, big, big deal, guys. Again, go ahead and take a look at that. Go ahead and take a look at this one more time, the income limits, and then we're going to talk about what medications are on that. So that is the income limit. Now I want to show you guys the list of medications that are on there. So here's the insulins. We've got Tresiba, Levemir, Novolog, Novolin, Humalog, and Humulin. And here's one that's not quite as well taken as Basaglar. But these are some of the most common insulins on the market. And these are whether you take them in a pen or whether you take them in a vial, that's going to work for you. So again, let's go over that list one more time. Tresiba, Levemir, Novolog, Novolin, Humalog, and and Basaglar, which I did help 2 people get just a couple weeks ago. These are the non-insulin injections. These are the ones that are most expensive. You're talking about one of these drugs, and I forget which one it is. It's either Trulicity or Tresiba. Is almost $1,000 a month. That means people who take these are going to hit their donut hole in 3 or 4 months. Trulicity, Victoza, Ozempic, and Tresiba, non-insulin injections. And then we have 2 type 2 oral medications that can be very expensive, Januvia and Jardiance, that are going to be, again, prescribed for free. If you want the application for this, please let me know. All you got to do is email me, call us, Aaron@getyourbestplan.com, or call 724-603-3403. We'll get that either faxed over or emailed, or use the old-fashioned mail to get that to you. And one more time, here's the income limits: $51,040 for a single person, $68,960 for a married couple. Again, I can't tell you what a big deal this is, guys. And the timing couldn't be better because most people hit their donut hole in May or June. Our months. So this is the time, if you're in that donut hole, we can get you these medications for free. Hopefully next year it'll be the same thing. And you don't have to wait till you hit the donut hole with these. So even if you're paying a $45 copay, or a lot of people have a $435 deductible, you can save that money as well. So again, call or email if you'd like a copy of the application. And again, to answer Patty's question, we will provide this regardless if you're a client or not. You don't have to change companies. These applications aren't cumbersome to complete. I'm telling you, they're just a 2 or 3 page application. The hardest part will be getting your prescribing doctor to fill their portion out. If you didn't see a brand name drug on your list, or if you're taking one for another issue besides diabetes, that doesn't mean there isn't a patient assistance program available. We're happy to give you the information and qualifications, or do some research if we don't have that information right in front of us. What we are encouraging people to do, again, we said you don't need to take our insurance to get this information, but what a lot of people are doing who've asked for it, we're saying, hey, do you want to be put on our mailing list? So they have a plan, or a company or a plan that we think is already a good company, and we wouldn't advise them to change, but that doesn't mean that'll be the case in the future, especially with Part D. Part D plans need to be looked at every year. So if you have a supplement, you can go on our mailing list and we'll tell you which prescription plan we think is best, or maybe your supplement goes way up and we can advise you when that happens and advise you if there's another company that could be better for you. This is also important with Advantage plans. You may have a great Medicare Advantage plan right now, an HMO or PPO, that's providing you dental and vision and all this great stuff. Well, what if they remove that stuff? What if they make your copays, you're worth $300 at the hospital for any length of time, and then you go to $300 a day for 5 days. So your hospital copay could go from $300 to $1,500 from one year to the next. We'll inform you if that happens, and we'll give you we send our clients a recommendation letter every year. They get that recommendation letter between September and October, telling them what the changes in their plan is going to be, if we think they should stay on that plan or they should leave that plan and look at another. We do that every single year for every single one of our clients. The U.S. Postal Service loves us. We're helping them barely stay in business. They're not losing quite as much money because of the health insurance store. We really contribute to the U.S. Postal Service as much mail as we send out. Hey, visit our website to watch my latest webcasts where we go into more detail again regarding the questions that we get in our column. Again, A2, Post-Gazette Fridays, A7, Tribune Review on Tuesdays. And you know what? If you got a question for the columns, just send them to me. Keep them coming and get us questions regardless of anything you have related to health or Medicare issues. And again, we're still providing services and consultations over the phone via Zoom, or again, we are approved to have them in our office. We do need to wear masks. If you're comfortable doing that, we invite you in. If you're not comfortable, we totally get it. I know that the COVID is spreading right now a little bit more than people would like. But if you want a face-to-face appointment, we can accommodate you. If you're not comfortable, again, don't worry about that. If you want to check out our podcasts, again, or subscribe, we encourage you to do that. You can just go to if you see here, there's our website. You go to Webcast Gallery. Very simple. You hit the subscribe button as you see there. Boom, you're in. And you can listen to those, watch those at your leisure. If you want to check out our podcast, you go to the podcast gallery right there in the top corner, and usually you'll see a subscribe button below my picture. Yeah, it's a much better picture than I normally than you're seeing on your screen today. But you just hit subscribe to that, and then you'll get emails whenever I do some new podcasts. If you enjoy them. So again, please tune in soon. You can find that gallery, listen to all the podcasts. Don't forget, if you want to call us with questions, if you want one of these applications, 724-603-3403, 724-603-3403. The website is getyourbestplan.com. We hope you join us for our next one soon. Hey, everybody, stay safe out there and stay healthy. We appreciate it. Thank you. Thanks for listening, folks. Join us again soon as we interview those on the front lines of healthcare, health insurance, Medicare, and our ongoing prescription drug crisis. My name is Aaron Zolbrod, and we look forward to helping you get your best plan at the health insurance store.